Hi, this is Andrew from Mandelay, and this is our new podcast channel. And our first guest is Fernando Crespo O'Neill from USA. He's part of the SST there in USA, and now in this podcast we will discuss why the woman health is necessary in our world, and how can we help for the women with our biofeedback technology. So welcome, Fernando. And what do you think about this topic?
I'm actually really excited about this topic. I know, right now we're here in Mallorca for the training event, and most of my clients are women. So I was excited to even be able to teach my subject, but it's nice that with our amazing software, we can support women's health of women of all ages. It's really wonderful.
Do you think that software is enough to help for the women's, or do we need to do something else?
It's definitely not enough. Our biofeedback is such a great complement, but our job as the practitioner is to educate our client on things that they're maybe doing that's affecting their own wellness and making their wellness not as good as it could be. So we have to be part of the teaching process.
Okay, so it means in biofeedback, we are not healers.
Right.
We are trainers and or teachers, and we try to teach our client or our patient how to live better.
Mm-hmm.
So that's our job. That's what we need to do. And one of the tool is our software or our device.
Correct.
What do you think? What we need? We need to improve ourselves as well.
Absolutely. As practitioners, you can also call us wellness coaches. And we have to constantly be educating ourselves. That's a great example of this training event. So far, these speakers have been great in teaching us things that, like for instance, for me, I've been doing this going on 18 years, and I learned so many new things that I can't wait to implement when I get back home with my clients. Things that to talk about them, like with what kind of skincare products are they using, or maybe what kind of foods that they're using that are causing them wellness problems. And then even from what Freddie taught, there's new things I want to try in the software for helping people with mental health wellness issues. So as a practitioner, it's up to me to keep learning as well.
Okay, so the good practitioner needs to develop themselves. It's not just helping for the client, because if we are not developing ourselves, how to help the client? We need to learn new stuff to know how the world is changing. Because like after COVID, what I realized, most of the people are more stressed, mm-hmm. or have more fear, or more own focus, and that's how the world is totally changed. What do you think about that?
I agree. We're living in the post-COVID world, and we can see that in the software that people are living with more chronic stress, more mm-hmm. chronic inflammation. They're having, and honestly, all the people that we come across all need to have biofeedback in their lives.
Yeah, that's what I realized. We have this number RFP, which it's resonate with the inner resonance. Mm-hmm. And what I see, most of the people has higher levels, so they have more inner stress because of the COVID or because of the fear. I don't know, but that's what I see. This level is increasing, and that's how the people are more nervous or more sick or have chronic inflammation. But we can help them to teach.
Before COVID, the resonant frequency pattern, we used to see that like say 15,000 and below. Mm-hmm. And now it's right around 30 to 40,000 constantly. So people, wherever that stress is coming from, it's coming from a lot of places.
And do you think that stress can cause problems for the women's?
Absolutely, yes.
So that's why, like in Europe, I don't know in USA, but in Europe we have problems with the births, so we don't have enough kids.
Or they have really in Europe also?
Okay. In Europe also, or like in Hungary, we have these PCOS problems, or a kind of hormonal problems and everything. So the women can be women anymore, like in Hungary.
Interesting. I had heard of that being a problem, say, in some of the Asian countries. I don't know if it's really happening as much in the U.S. I would need to educate myself more there. But I found it interesting in one of the classes yesterday that the amount of chemicals that, say, women are exposing themselves to from their daily skincare, like that the average woman can expose themselves to 168 chemicals just with their skincare and cosmetic routine. And some of those chemicals are actually endocrine disruptors. So now as a wellness coach, as a practitioner, I get to try to encourage my clients to maybe think about if they're having hormone problems, or like you're saying, maybe in some of the parts of the world where they're having fertility problems, it could be just because they're trying to take care of themselves, but that product is actually poisoning them.
Of course, all of the skincares. Now in Hungary, we have different kind of courses to how to choose the best skincare products for your own self.
Nice.
Because now we can use the bio marked creams or something like that. But if you have the sticker, it's bio, it not means it's good for yourself. So you need to learn how to listen for the body and how to understand the signs of the body, which is good for you and which is not. So it's not easy. And of course, we need to train the body as well to detoxify that not healthy information. So it's not easy, the today's world. And what about the foods?
Foods are the same way. I mean, now I have to admit, in Hungary, I think you guys are spoiled because you have wonderful food. And I found my experience of eating food in Hungary, there's less chemicals in the food than it is in the United States where I'm from. So that's wonderful. I know there's things like that, but yeah, our clients can be having toxic reactions from the food that they're eating.
Yeah, in Hungary, the GMO is absolutely not. So our government says no GMO food in Hungary.
That's wonderful.
Yes, but don't forget the pesticides. Don't forget the sugar or the fast foods. Probably it's not genetically modified. It's not food. So we can say not fast food, it's bad food. And all of these developments are creating hormonal problems or digestive problems like leaky gut in our body. So during that information, our woman health can be not healthy part.
Yeah, negatively affected. Yeah.
Absolutely. So do you think our technology is the key to get better?
I would say yes. I think our biofeedback technology is really a big key in helping our communities try to be healthier.
Okay. So it's something I hope the listeners of this podcast can understand what we are talking, and maybe they can find a good biofeedback practitioner, or they can think about it to buy a device for own self and do the sessions. Oh, by the way, which is the better way? You need to find a good biofeedback practitioner, or you need to buy a device for your family?
I would say find a good practitioner first.
Yes.
Some people are not good at learning new things, and our software is very comprehensive. There's a lot of components to it. So people that are not used to, say, using a computer, or they're not good at learning new things, they're going to be slow. So, but they can immediately help their family now by finding a practitioner in their area.
Yeah. It's good. Yeah, that's what I usually use for the Hungarian clients. Our software is not user-friendly. But because it's
say the same thing, but I didn't know if I could say that to you. So thank you for putting those giving me permission.
Yeah, so it's not user-friendly, but that's our, that's our super power. Because with the not user-friendly software, that means if you understand the software signals, you can dig deeper and you can have much more information than other systems.
That's a really neat way of putting it. Since it's not user-friendly, it makes you have to use it. If it was user-friendly, it'd be more maybe automated, and people wouldn't have to use they wouldn't have to use their brains as much or think as much. So yeah, I've said that for years. Our software is not user-friendly, so you have to have training so you are using the software properly.
Yes, but everybody can learn how our software is working, so it's not that easy, but you have the tool, you have the teachers, and of course then you can be a good biofeedback practitioner, or you can be a good choice for your family. So thank you for the discussion. I think we discussed everything about the biofeedback and the biofeedback, how fit with the woman health. So let's go move forward, and we are coming with the next episode soon, and let's see how our podcast will be working. Thank you so much.
Well, thanks for having me.